Averages 70 pregnancy-related deaths each year, and 80% of those are determined to be preventable. Chris Bryant is live in the newsroom with more on this. Chris?
Yeah, good afternoon, Rob. According to the Missouri Department of Health and Senior Services, between 2020 and 2022, 128 women died between 43 days postpartum and 365 days postpartum in the state of Missouri. Now, Southwest Missouri had the third largest rate of that when it comes to across the state. St. Louis and Kansas City took first and second. While Missouri averages 70 pregnancy-related deaths each year, that number dropped from 85 in 2020 to 61 2 years later.
We attribute some of that to COVID. We saw more moms, unfortunately, dying directly from COVID-19, or that their care for another condition was delayed because of COVID-19.
Cardiovascular disease, mental health, and infection are the top three causes of pregnancy-related death in Missouri. In addition, data from the state shows that women over 40 and those who are Black saw the highest death rates.
The gap between Black moms and white moms is closing. And so it's not gone, it's still there, but we have seen it start to shrink over the last 4 years.
And death rates were higher among women enrolled in Medicaid.
So when we look at how folks are insured, that if you have Medicaid, you're often have lower resources, financial, maybe transportation, things like that. And so when those things kind of compound, then we see, folks having worse outcomes.
And in more than half of the deaths, substance abuse was not considered a factor.
And the things that we see in our cases that can be really upsetting is providers not necessarily knowing how to address drug and alcohol related conditions during and pregnancy and postpartum. So we see folks who've maintained some level of sobriety, and then in their postpartum journey, they're offered some sort of pain reliever medication as a part of their postpartum healing, and that's not always considered. Or
in addition, those with a high school degree saw the highest rates of death at 201 per 100,000. And those not married saw rates at 207 per 100,000.
If you think about all the different people who've given birth, all the different moms who've had babies over the last year, 70 isn't, one is too many, but 70 is not the biggest number. And we want it to keep getting smaller. But those stories and what we see in those 70 cases, we know are happening to moms. Even if they're not dying, they're experiencing the same sorts of conditions.
Now, one of those things that doctors and those that I spoke with are working to do is kind of help key in and kind of get an idea of those warning signs for patients. And that's going to be part of the Ask Me 5 campaign that is going on. Now, what that's going to talk about is whether or not you have high blood pressure, emotional and mental issues that may be playing a part in your pregnancy, in addition to access to care, substance abuse, and if you're safe at home, or all those questions that doctors will start asking patients through this campaign. Now, those I spoke with said it's important, no matter what, to make sure that you're your own advocate for your health care. If something doesn't feel right or if something's wrong, speak up, speak to your doctor about your concerns. To see all the statistics and for links on the information inside this story, we have it online at ky3.com. In the newsroom, Chris Bryant, KY3 News.